Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another intriguing young woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Hello, everyone. My name is Dr. Anne Peled. Thank you so much, Gertrude, for having me. I am a breast cancer and plastic surgeon, and I live in San Francisco, California. And my story really begins actually where this sharing today when I was 37 years old. I was diagnosed with breast cancer. And it came as such a shock, as I know it does to so many people, but especially for me, being a breast cancer surgeon myself, being hit with the disease I treat every day really felt like even more of a shock than usual. And I remember I had gone in for a biopsy because I had a lump that hadn't gone away after a couple of weeks. And I did what I tell my patients to do, which is to go in and get it checked out. And I was starting surgery on a woman who had breast cancer and was having a double mastectomy. And I saw my phone ringing from one of the pathologists I work with. And I picked it up, expecting she was going to tell me the biopsy was benign. And she told me it was invasive breast cancer. And the moment comes back just so immediately and instantly of what it was like to be there, about to scrub my hands, get into my gown for the surgery, and finding out at 37 I had breast cancer. So I got through surgery that morning. I canceled my afternoon of clinic patients, and I started a journey of workups, of breast MRIs, of ultrasounds, of waiting to find out if I need chemotherapy, to making decisions about what I was going to do with my breasts and how I wanted to look and feel. And if I was going to tell my 3 children who were 6, 3, and 3 at the time. And it was certainly so much to go through, but ultimately I felt like after that first really challenging conversation and bit of news, everything from that point actually went fairly smoothly. I had a lumpectomy, I had radiation, I did hormone blocking therapy, I got back to my life. I was doing my screenings every 6 months and really felt like I was cancer-free, doing well, living my life. Until just a few months ago, when I went in for a routine screening mammogram and found out I actually had another cancer. And finding out at 44 with what I think is a really healthy lifestyle, I exercise every day, I'm a vegetarian, I really try to take good care of myself. I have to say it was just an incredible shock again to be back in that place and be back thinking about having cancer again. But what's been so different and so transformative, I think, this time around is one, I've developed over the last 7 years, this incredible community around me as I built my breast cancer practice, as I got to know colleagues in the space. I've also really worked hard to develop research and actually a surgical procedure developed with my husband to help people keep sensation, which is usually lost after mastectomy. And so to be in this place again, even though I had to go through it once and never thought I was going to have this again, really feels different in a really beautiful way. And my outlook on it has been different. The love and support I've had has been different. being able to tell my kids this time and have them there for me through this has been incredible. So I'm now a month out from having had a double mastectomy with reconstruction and the kind of sensation preservation option that my husband and I developed after my last diagnosis to help people like me go through it. So again, I think I hear from so many people of, how do you get through that initial shock? How do you get through what it's like to think about having cancer? And I have to say for me, finding your places where you can feel strong, you can feel positive, you can know what the other side's going to look like, and you can embrace the community that gets you through it has been so huge. So that's where I am today, a month out, recovering and feeling fantastic.
Wow, what a journey you have been on. It's got to be strange to find yourself on the other side of the doctor's table. You're normally on this side helping your patients get through challenges like this. But what I really want to know is, how did your second diagnosis change your perspective on healing and medical treatment?
I think for me, really giving myself grace in terms of what I needed for myself physically, psychologically, to allow myself to take this in this time around has been really huge, and certainly has really impacted how I empathize with patients, to think about what it's like to be waiting for results, to be wondering what the next steps are going to be. And I feel incredibly grateful for being able to have the most amazing team, know what it looks like to go through this. But it's also been really empowering to think about others in my position and to try to do an even better job to give them kind of some of those insights I get to have being on both sides of things.
Mhm. So tell us about the technique that you and your husband pioneered to preserve breast sensation. Why is that so important?
So many people don't even know, which is so heartbreaking to hear, that with a standard mastectomy, the nerves that allow for you to feel your skin, your nipples, even the skin up into your neck and your chest and your upper stomach actually get cut with the standard mastectomy. And one of my friends tells the story, which is so heartbreaking. She says she puts on a sports bra and doesn't even know it's on. And just to think that you would go through life having this whole part of your body you couldn't feel, whether it's hot water from the shower or hugging a child or a partner, it's a really big deal. And I think a lot of people don't even know that might happen. So for me, I did know that was going to happen if I'd had a mastectomy when I was first diagnosed. So my
Right.
husband, who's a nerve surgeon, and I have worked together to help pioneer, teach others, be a part of a movement to really allow people to have their nerves either preserved or reconstructed during their surgery. And many people tell us they almost feel like they're back to normal as they heal from their mastectomy. So it was a huge relief, honestly, to go into this surgery this time around, knowing that was going to be an option for me.
That's amazing. So, what's the biggest myth that women still believe about breast cancer recovery?
I think people often feel that much of what either they did or didn't do was going to cause their cancer in the first place or might
Mm.
impact how they heal from it. There's a lot of guilt, unfortunately, in the world of cancer in general. And so I think
Yeah.
one of the gifts I try to give people is breast cancer, to some degree, doesn't care about all those things you do in terms of why you get cancer in the first place. It's not your fault. But what I love is all the healthy choices people make do help in your recovery. So I always
Mhm.
encourage people, don't stop doing all the healthy choices you were doing before. Get an exercise program to decrease your chance of recurrence, and don't feel like all that was lost just because unfortunately you did get breast cancer.
Yeah. Now, how do you navigate both a clinical and survivor? Does one side overpower the other?
That's a really good question. I think the survivor piece of it, I find in many ways really, I hope in a positive way, allows me to connect with patients. And I try not to bring my story in unless they ask. But I think understanding what it looks like to have optimism and hope and to feel strong in the midst of something that's so overwhelming and so out of control. I like to think that hopefully makes my clinical care better because that's where I'm driven from and want to share that with my patients too.
That's just amazing. Now, what's the most common question that your patients ask, and how do you answer it?
So the first one is always going to be about how people are going to do long term. We hear cancer and we worry we're going to die of cancer. That's just a known thing that we all go through. I go through too. And so I really try, I tell myself this all the time, to center yourself and ground yourself in data because that's the best we can do, right? And we know that not everyone follows all the rules, unfortunately, of how things are going to go, but the best we can do is what we know about it. And so that's where I get to tell people, you did your job. You got your mammogram. We found this when it was early. Or in my case, I was too young to get mammograms, but I went in and got my lump checked out. So I could get it picked up when it was early stage. So I just like to remind people, fortunately, most breast cancer is highly treatable. And it's really a question of, again, being empowered to do the steps that you need to do your treatment, to do everything that you can to try to prevent it from coming back and being life-threatening.
Yeah. So, how did your children respond to your journey, and how have they shaped you? How have they shaped your resilience?
I often think that finding your why when you're going through anything as challenging as a new cancer or health diagnosis is so huge. And those munchkins are definitely, definitely, definitely my why. And it's been really lovely this time around. My oldest is now 14 and my twins are 11. And my 14-year-old follows me on social media and he knows what's going on because I've chosen to share my story. And it is the most beautiful thing seeing your children check in on you. And he takes me to the gym so we can make sure I'm getting back into working out. And I think sharing with them, honestly, this time around has been so good for my soul to really be honest and open and be myself. And when I know I can't pick something up because I'm healing, to ask them for help and not feel bad about it as a mom that they're helping me. It really feels like I'm kind of being much more myself this time around with them than I was the last time when I thought they were too young to know. And it's been such a huge part of my recovery this time around in a really positive way.
Oh, wow. Now, you talk about daily wins. Can you walk us through that gratitude practice and what it does, what it did for you and what it does for your patients?
This has been a relatively new part of my life, even though I'm someone that really appreciates, let's say, being outside and looking how beautiful it is when you hike. But this new practice of really trying every single day before I go to bed to think about the day and to find some wins from the day has set up, honestly, every day I wake up in the morning and I feel calmer and I feel ready to tackle the day in such a stronger place than I used to. And it's something I share with my kids too. And I always say, even on the roughest of days when you don't feel strong, you feel like things have failed and haven't gone the way that you hoped, there's always something. You made a beautiful meal for your family. You got in an extra 15 minutes of walking you were hoping for. You made someone at work's day by thanking them for something that they've done. Those wins really sit with me in a way that I wake up the next day, like my energy is there. And I remember, okay, there are wins coming today. And it's something I think, especially in the midst of treatment, when you do feel so out of control, it allows you to remind yourself who you are and what you bring to the world. And I think that's incredibly strong place to be going into, especially when you're in the midst of treatment.
So, how do you maintain hope during long-term recovery?
I really like to think ahead to what I have to look forward to. And to some degree, when you're sitting there thinking, okay, I don't get to go to the gym, I don't get to run, which is one of my happy places for sure, that you can sit in that. Or you can do like, what is possible? What's that going to look like? And so for me, I've been thinking about how can I start signing up for races in a few weeks. When I was diagnosed the first time around, I used to wear my workout clothes to radiation therapy. And I would go run every day after radiation. And it was this thing to look forward to that I could get into. And knowing it was coming every day just made sitting there in radiation and everything that was challenging about that so much easier. So I think find your light at the end of the tunnel, find what you're looking forward to, and craft that. It's kind of, possibilities are endless once you're healed, right? So what is it that you want to do, and then have that to look forward to and create your life to get to that.
So, what's one thing that you wish every woman knew before walking into a cancer consultation?
Mm. I am going to give two, only because I think they're equally important. I think the first one is that for almost every situation, you have time to make an informed decision. And I think we hear cancer and we think, oh my gosh, we needed that out yesterday. And I get that psychologically, but for most people, medically, it is not an emergency. And really take the time, because a lot of the choices we make, you can't undo. They have long-term consequences that sometimes you could have made a different decision if you let yourself have more time. And with that comes really trying, if you can, to get more than one opinion. And I know that's not always possible depending on where you live, but if you can, it really allows you to hear things in a different way and to know what might be possible. Because sometimes people aren't even given all the options, because it might not be in the first person you saw's toolbox, but then you see someone else and you have choices you didn't even know were possible. So I think those go hand in hand, but it's so important, if you can, to just take a breath and realize that medically you have time to make a good decision for yourself.
Yeah, yeah, that's so good. So, how do you empower women to advocate for pleasure, sensation, and emotional healing, and not just the physical?
It's so great that nowadays I think we're in at least a better place, even if we still have room to go, on allowing women to talk about the fact that these things matter. Even watching how we have a greater focus on menopausal symptoms and what it looks like to go through that, and really talk about how this impacts our day-to-day life, is a huge change, even from a decade ago. So I think to start, just knowing you're not alone in that, and lots of women are thinking these things and now are starting to say these things, is a big one. The second one is that I've learned, and I try to share with my patients, is your life outside of cancer matters so much. And the day before your diagnosis, you're a person who had all these things that matter to you, and they're going to get to matter again. And trying to do everything you can to get to that other side is so key. And you want a provider who understands that, right? Who gets to know your life and helps you think about making choices that support the things that matter to you, because they're different for all of us. So I do
Yeah,
think finding someone that you feel comfortable having those conversations with is incredibly important. And sometimes that's an online community.
yeah,
Sometimes it's just finding people who allow you to say, I would really like to have my breasts be a part of intimacy again after this treatment, and let that be okay, which it
yeah.
is. And so I think it's a lot of time finding the right people for them.
So, what role does storytelling play in transforming healthcare systems, do you think?
Honestly, hearing people share their stories and what matters to them, I really think is one of the biggest drivers for changing the standard of care in many cases. I
Mm.
use the sensation preservation all the time to tell my patients to share their stories around it, because it allows other surgeons to know it's important. They hear,
Yes.
oh, that patient said, I only went to this surgeon because she was able to preserve my sensation. They'll start doing it. And insurance companies, right? Then we get better coverage when they know that their clients, if you will, are going to go to different providers and do different things because they can have sensation preservation. So the
Yes.
storytelling we see, it allows people, one, to know that their journeys are unique and special, but also to some way that there's also a commonality with all of us. And so it
Mm.
makes you realize, oh, other people have this. That's something else that's important to me. It was important to them, and I'm going to get my care that supports that. So I think storytelling is huge in healthcare.
Okay. So, if you could reform one thing in women's health, what would that be?
I think even with all of the progress we're making, we still hear too often that women's symptoms, what they're feeling, what they're worried about, they're still not taken seriously much of the time.
Yeah.
And my example in breast cancer is I still see, I wish I saw it less, but I still see young women going in with a breast lump or another concern, and they're told you're too young for breast cancer, come back in 6 months, it's probably nothing. And then unfortunately, a lot of times people are getting diagnosed late. And we see a lot of healthcare disparities really show up in that, where that's even worse for certain, women of color and women who are non-English speaking, let's say in the US, that some communities it gets even worse, to be honest. And so I think for us as providers, as a healthcare system, just taking every one of those conversations seriously and trying to have equity in terms of what we offer for workup, it would save lives. And all different subgroups, it would save lives. And so I hope that we can get to a better place there.
So, how has sharing your story impacted your work and your community?
My patients have been so lovely. The number of messages and the ways that people have reached out, to have your own patients that you just operated on send you pictures of them working out, not just because it's happening, but to remind you you're going to be on that side.
Yeah.
Or they share bra recommendations with me, or how I'm going to learn to sleep on my back. So I think just my current patients, and it's beautiful. It's really beautiful. And then bigger picture community, I've been trying really hard when I can to share parts of my journey that I think other people might not have access to, because I am so fortunate and so privileged to have medical access, education, knowledge, a community of providers. I try to share the things that I'm doing to say, even if you didn't get offered this, this is out there. Ask
Yeah.
about it, because this is the gift that I can give because of the privileged place I am in terms of being being someone who treats the disease that I'm also going through. So it's been a really beautiful part of the second go round.
So, what are the physical things that change for you when you've had a double mastectomy? You just mentioned learning to sleep on your back. This is the first time I've heard this. Tell us, what is the transformation or the
So
adjustments?
yeah, a lot of it depends on whether you have reconstruction or not and what kind of reconstruction you have. But in
Mhm.
general, certainly in the first 4 to 6 weeks after healing, you really have to be careful that you're not impacting any of your incisions or putting pressure on your reconstruction. So for me, I did have reconstruction with implants at the time of my mastectomy. So it means I can't lie on my stomach and kind of can't lie on my side so that I'm not getting swollen. So this is a cute thing that some of my patients have shared with me is how to design a pillow fort for myself to stay in a place so that I don't roll over. So I think in the short term, that's a big one. There can be real changes in mobility. So some kinds of reconstruction do impact the muscles, certainly having your nerves impacted and how you feel in space. And that's a big one too. I know for myself, I just trying to push right at the edge of what's possible in terms of mobility and strength and getting back into that. And
Yeah.
my biggest kind of gift I've been trying to give to everyone is to try to get into physical therapy or rehab or a trainer as soon as it's safe, because that mobility, that ability to move your body again in your daily life is going to make a huge difference in how you get back into your life long term.
Wow. These are things you don't think about.
Mm-mm.
So, what's your message to a woman who has just received her diagnosis right now and is feeling totally overwhelmed?
You're not alone. You're really not. I mean, in the US at least, it's 1 in 8 women are diagnosed with breast cancer. That means every single person who's diagnosed is going to have someone in their community, whether they know it or not, that's going through this, maybe even at the same time. So I would say, first and foremost, find your community, whether again, it's online or support groups through your hospital or cancer center, but really find people who get it. We say in one of my groups that I belong to, worst club, best members is the people impacted by breast cancer. But it's nothing any of us would have chosen, but it's a
Mm,
really incredible community. So I think for sure, just knowing that there are so many of us here to get you
yeah.
through it. And there will be another side of this, right? So I think we've all been in moments in our life where it feels like every single thing is falling on top of you all at once, and you don't know how in that moment you're ever going to feel like there's another side to it. But there will be.
Yeah.
This will be a chapter. There will be something different. There will be another side. And I love getting to take people through that. And I love knowing that there will be another side of this for me too. And I think that's incredibly powerful to take that moment and remember that.
So, what surprised you the most about yourself during your cancer journey? Something that you didn't know you had in you?
I've been through a lot in general in different parts of life that I knew that I was going to be resilient. I think that wasn't necessarily a question, but I
Mm,
don't think that I knew that I was going to find room to be so vulnerable about parts of this.
yeah.
One of my worst moments in this entire process was when, after my lumpectomy, I had to go to radiation therapy, and I pulled into the parking lot, and the spaces were labeled and it said patient in the spot I was supposed to park in. And
Mhm.
I'm like gonna cry out. It's gonna make me emotional thinking about it now. And I've been parking in physician parking lots,
Yeah.
for decades, and pulling into the patient parking lot. I mean, I lost it. And I tried to pull it together to see my radiation oncologist, and she walked in, and I just lost it again. And it was really incredible, like sharing with her, what that was like as one cancer doctor to another, how hard
Yeah.
that was. And I didn't expect that. I thought I was just going to be really strong and get through it and no big deal. And I think being able to allow for those moments, it's made a big difference in my healing. I didn't expect that. Sometimes it makes you feel like those moments are going to make your healing worse. But I actually think acknowledging when the moments are hard and sharing,
Yeah.
for me, it was a surprise in a lovely way.
And I think it also helps you relate to your patients' journeys more now that you're on this side of the fence. I can imagine.
It really does. Even just understanding how to give news, just thinking
Yeah.
about, right? Like how you tell someone they have
Yeah.
cancer or their cancer is spread. And I like to think I knew how to do that before that. But now, having been on the other side of that phone call, it just hits different in a major way.
Wow. Now, my last two questions are a bit of a thought experiment. In the first one, I'm going to teleport you back to that young woman who got her first cancer diagnosis. If you could go back and give her three nuggets of wisdom based on what life has taught you up until this point, what would those three nuggets of wisdom be?
So I would say the first one is there are more people and there's more support there than you know. Having a cancer diagnosis or any kind of diagnosis like this can make you feel really alone. And now looking back, I realize I had so many more people in my corner than I even knew at the time. The next one is that it's okay not to know everything, and that it's okay to get help and to not always be as strong as you think you need to be. Certainly, as a person who got diagnosed with a disease I literally treat every single day, day in or day out, it was hard to acknowledge that. And it was hard to really make space for the fact that I needed help, and I needed help as a patient. And then the last one that I think I would say is kind of like I was saying before about there being another side to it. But I think leaving hope and space for the possibility that life might be even better than you're expecting. And my life is actually, as crazy as it's going to sound, my life is better and fuller as a result of that breast cancer diagnosis. The work I've been able to do around sensation preservation, the bonds I've made with my community, the patients who've become great friends, my life is better as a result of that cancer diagnosis. And I would never have expected that.
That's amazing. My last question is futuristic, and I'm going to teleport you into the future to go and have a conversation with the 90-year-old you. She's sitting in her rocking chair, surrounded by her children, her grandchildren, whoever's with you at the end. If we could teleport into the future for you to meet this wise woman who has led you up until this point, what will you say to her when you finally meet her? Because I'm pretty sure the work you're doing with your husband is just the beginning of more work to come to help women with breast cancer. What will you say to your wise woman when you finally meet her?
I think I would want to know how it felt to make the impact that I'm really hoping, like you just said, that I'm really hoping to make, and to know that being vulnerable and sharing my story and being out there and using this cancer diagnosis to transform the world in the way that I want to, like, I'd love to know, how that feels, and that feels the way I can already feel it's starting to, and what it looks like on that other side. I think also I try really hard with my kids to inspire them just through living in a certain way. And I think it must be so beautiful, and I hope it will be, to look at this family around and feel like I've inspired my kids and their families to wake up every day and try to think about what they're going to do to make this world healthier and sparklier and more connected. So I think I would love both those things.
Fantastic. Well, thank you so much for coming online and sharing your story with us, Anne. It's always amazing when I meet women who are sharing their stories to empower others. You've been through a lot, but you're doing something with the story to inspire others who are going through a similar challenge. So thank you for sharing your journey with us today.
Thank you so much for giving me and others like me a voice to be able to share. I really appreciate it.
And thank you to everybody who tuned in. The Her Story Circle is not just a podcast. We're a social impact movement that brings you the stories and voices of women from all over the world. We share our stories to uplift you, to inspire you, to energize you, but most importantly, to take you from where you are now to where you're trying to go. So if you are a woman who's just been diagnosed with cancer, breast cancer, whatever type of cancer, don't be scared. The technology is there, the science is there to support you. Look for alternative, ask questions like Anne said. Don't just rely on the first doctor that you see. If you're not happy, be inquisitive and find out and advocate for your health as well. I'll be back again tomorrow, everybody, with yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. And thanks again for the interview.
Thank you.
Thank you for tuning into the Her Story Circle podcast. I hope today's story has inspired you to believe in the power of our stories and the difference you can make in the world when you use your voice. I'm Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a rich tapestry of diverse perspectives. Don't forget to subscribe, rate, and review our podcast to help us share these stories with more listeners. Follow us on social media by looking for the Her Story Circle podcast for more updates. And join us tomorrow for another episode filled with courage, resilience, and empowerment. Remember, your story matters, and together we're building a stronger, more inclusive world. Until next time, keep making her story.